Good afternoon, everybody. This is going to be the introductions now. And before the introductions, can I just remind you to turn your phones silent, please? And also, please be careful if you're balancing your lunch on one of the attached things, they're liable to go wrong on you. Today I'm delighted to welcome our guest speaker, Nicola Piper, and we also have Laura Foley from in-house that you know very well indeed. Nicola is one of our guests here on the BICS funding scheme, which allows people in UCD, and particularly within the Geary community, to bring a visitor from overseas to the Institute. It's a scheme that seems to be working out really well. We're hoping to run it again next year, though if you haven't applied, I'd invite you to think about applying next year and whom you might like to ask to visit. So today, Nicola and Laura are going to present on gender and migrant worker immobility, a global crisis perspective. Nicola is a very well-renowned international professor of international migration, and she's a founding director of the Sydney Asia Pacific Migration Centre at the University of Sydney. She was also on secondment and a British Academy Global Professor Fellow hosted by Queen Mary University of London School of Law. And in another life, when she was at the University of Sheffield, she came across Laura and supervised her PhD. And she and Laura and Nicola have done work together on migrant worker communities and the various impacts that things like COVID-19, etc. have had on them. So without further ado, I'll hand over to Laura and then to Nicola. Thank you.
So thank you very much for inviting us here to share our work today, and thank you for awarding us funding under the BICS scheme as well. So our presentation is based on work that we've done that analyses the relationship between mobility and immobility in or as moments of crisis from a gender perspective. So our analysis focuses on how COVID-19, both the virus itself and the massive state intervention that followed, represented a crisis moment with far-reaching consequences. And global analysts called COVID-19 the great disruptor of migration. And more specifically, our research examines how the crisis moment impacted migrants' mobility and immobility. And we argue that the fallout from COVID-19 spurred both a labour mobility crisis and a dual care crisis, and that these crises were underpinned by a malfunctioning institutional landscape which disproportionately impacted women migrant workers due to the additional care burden that they faced, their positioning within gendered labour markets, and the barriers they faced in accessing care. So we argue that the pandemic highlighted the seriousness of the existing institutional crisis because in particular it exposed the lack of global avenues through which returned migrant workers were able to pursue justice for labour rights violations. And our analysis uses a temporariness-precarity framework, which Nicola will speak more on in a bit, to underline the gendered mobility implications of COVID-19 by highlighting how migrants workers' lives are shaped by their temporary and insecure migration and employment status and their limited access to social protection. So this work is based on research that we did as part of a project called Unpacking the Global Governance of Labour Migration that examined the efforts that have been made over the past 2 decades to advance decent work for migrant workers at the UN level and through actors such as civil society organisations and global unions that advocate at and work with UN agencies. So due to COVID-19, we were prevented from conducting fieldwork in the regions that we planned to visit, but this in turn, we were provided with the opportunity to look into the ways in which the pandemic itself was exacerbated existing flaws in the global governance system. And the work really started with a report that we'd been approached to write for the International Organization for Migration in June 2020, so in the early waves of the pandemic, to examine how women migrant workers were being impacted by COVID. And this is when we also started to track various countries' policy responses to the crisis. So in this talk, we will look at the connections between crisis, mobility and gender, examining how COVID-19 impacted migrant workers and underlining how the mobility regime that governs cross-border movement, how this regime exacerbates vulnerabilities. So we're interested in understanding how external crisis moments impact on the cross-border movement of workers and in shedding light on specific gender inequalities. The pandemic provided us with an opportunity to interrogate issues relating to gender and mobilities because we argue that in examining the fallout from the COVID-19 crisis, it became clear that the pandemic underlined and exacerbated pre-existing gender inequalities within the restrictive global labour mobility regimes that migrants must engage with in order to move and work. And these regimes constrain migrants' ability to move. They restrict the sectors that especially migrant women, can enter, and they often render migrants temporary and therefore precarious. And we approach this from our mutual interest in human and labour rights and in rights advocacy. So throughout history, cross-border migration has rarely been subject to the full freedom of mobility enjoyed by all and at all times. So due to structural, political and regulatory reasons, cross-border movements have typically occurred along a spectrum ranging from full mobility to complete immobility, and often along gender lines or with gender effects. And this is reflected in the split between the migration of the highly skilled and what is regarded lower skilled, synonymous with low wage, with women tending to be overrepresented in this latter category. And the numerous attempts made and methods that have been developed to control the movement of people have responded to systemic shifts associated with various crisis factors such as economic downturns, demographic shifts, political conflict, environmental degradation and climate change, and of course, health pandemics. And these shifts have triggered certain institutional dynamics, including the gradual institutionalisation of migration as a policy field, which over time has led to a more unified approach to cross-border mobility across the world, often in response to moments of crisis. So, for example, this is particularly evident with the refugee crisis in 2015 that triggered the negotiations and eventual adoption of the Global Compact for Refugees and the Global Compact for Safe, Orderly and Regular Migration. But the outcome of this unified approach to the regulation of labour migration has been a shift towards an increasingly selective and restrictive legal framework that permits legal worker mobility mainly on a temporary basis, which results then in deepening the precarity that migrant workers face. So many formal labour migration pathways worldwide consist of migration regimes that have been constructed to facilitate strictly temporary employment in a limited range of low-skilled and low-wage labour market sectors, where workers receive no security and no pathway to permanent residency. And what's also important and problematic is that workers hired via these temporary contracts, they're employed under highly rigid circumstances. So they're bound to a specific employer, a specific location. They are unable to change jobs, and their employer has significant control over their movements. And furthermore, this type of migration is financed through debt, and it's facilitated by a problematic migration industry, so private recruitment agencies, labour brokers and various intermediaries. And at its most extreme, temporary migration schemes can lead to modern forms of slavery. Workers are often kept in place for specific projects, such as construction, or for specific periods of time, for example, seasonal agricultural works. And for women, the fallout of being kept in place is higher exposure to sexual violence, and there's abundant evidence of sexual abuse in domestic and agricultural work. So international labour migration is driven by a number of factors, such as the pursuit of higher wages and better opportunities. And as workers, migrants are part of the world of work, which has been shown to be inherently gendered, because labour markets are segregated by gender, race, age, and skill level. And men and women are unevenly concentrated in different sectors. And even when working in the same sector, they will often perform different duties. So women are considered more amenable to certain sectors such as care-related work and manufacturing, in which the roles designated to them tend to be less valued by society, which still tends to take the male experience as its norm. And the gendered segregation, this gender segregation by sector is legitimised by attributing certain natural abilities and inabilities to women, epitomised by the nimble finger concept or by women's allegedly innate caring abilities. And furthermore, the sectors which women migrant workers are often concentrated in have a high risk of violence, harassment, exploitation and abuse, and this has been highlighted by the UN Secretary General. And even when performing the same duties, gender differentiations manifest in lower pay for women, which some refer to as the gender pay gap, which we had an excellent seminar on a few weeks ago. So the tendency to undervalue women's work is also reflected in the definition of skill and the way in which migrant and non-migrant workers are classified along the highly skilled to unskilled spectrum. So women's work has historically been grouped under unskilled, and so is a large part of the migrant workforce. And as a result, inferior conditions tend to be offered to large parts of the female workforce worldwide. And in fact, the debate around domestic work and the advocacy efforts leading to the negotiations and eventual adoption of the ILO Convention 189 on decent work for domestic work revolved exactly around these types of issues, the recognition of this type of work as paid employment that involves skills. Now, while migration may be seen as a way for women to escape gender inequalities, restrictive gender roles, discrimination, poverty, insufficient social safety nets, and limited employment opportunities in their home countries, women's labour mobility still remains constrained by a range of social, cultural and political factors. And as Shamir notes, the mobility regime is constructed to maintain high levels of inequality. And in this regime, a person's ability to move is affected both by the policies of individual states, but also by changing international regulatory and surveillance administrations. So individual governments help to construct and legitimate mobility regimes by enabling some individuals to move, while at the same time implementing controls on the in-migration and out-migration of others. And to do this, states use national identities and nationalist ideologies to justify the exclusion and inclusion of who can cross state borders. And gender is often used as a category of exclusion, as gender-related discriminatory social norms prevent women from having the same level of freedom of mobility as men. And the gendered segregation of labour and labour markets funnels migrant women into certain types of jobs, such as nursing, domestic work, cleaning and manufacturing, which are often precarious and labour-intensive. And the regulatory frameworks, such as the bilateral agreements that are put in place between countries, these serve to tightly control the type of work that women are able to pursue overseas. And these agreements push women into sectors that have already been deemed as suitable in the eyes of the state and employers. Now, political, economic and environmental crises are often associated with elevated levels of cross-border mobility. And gendered labour migration is a response to crisis, and the migration of women often responds to gendered forms of socio-economic crises. Economic crises in specific countries have been shown to prompt increased movement of people as people dispossessed and lacking opportunities seek work further afield. And some states also importantly encourage out-migration as a strategy to alleviate unemployment and to increase economic growth through the receipt of remittances. But at the same time, migrants' very presence in destination countries often triggers a discourse around the crisis of immigration control, due to the perceived varying impacts on public finances, economy and society. And such talk may at times reflect genuine policy challenges, but immigration is often used as a convenient scapegoat for wider societal problems, with the actual impact of migrants in most states difficult to discern. And in countries of destination, economic crises are often linked to perceived or real labour shortages, but they're often symptoms of falling labour standards and reduced wages, as reflected in rising or persistent unemployment among the indigenous workforce existing alongside an underpaid and highly exploited foreign workforce. So in resource poorer countries of origin, the job crisis in the form of under and unemployment leads to migration becoming a survival strategy for individuals and a safety valve for governments in the attempt to avoid deepening social and political conflict, and in an attempt to reboot economies. So in this sense, crisis can be the trigger as well as the outcome of cross-border mobility. But I want to note that the gradual institutionalisation of migration as a policy area at the global level is also often in response to crisis and therefore a form of crisis management. And the emergence of a rights-based approach in the global governance of migration, as per various ILO and UN conventions, has been patchy and not sufficiently gender responsive or gender sensitive. And furthermore, the rights-based approach has been eclipsed by a securitised and utilitarian approach to migrants. And in relation to the multi-actor character with a rising number of organisations claiming a stake in migration, it's important to underline the global governing system for migration has institutionally remained siloed and fragmented. So how did COVID-19 shift the playing field? Well, the pandemic triggered a moment of transition which provided a unique opportunity to observe through the lens of migration how crises bring into view the contradictory dynamics that are intrinsic to mobility regimes and their regulation, underpinned by the equally contradictory dynamics of how the global economy is organised. So historically, international labour mobility has been a key strategy for the redistribution of systemic risk. So despite a global surge of xenophobia, this pattern continues today. And during the pandemic, we saw migrant workers channeled towards essential jobs on the front lines. So in this regard, the COVID-19 crisis underlined a pre-existing paradox. Migrant workers, while often seemingly unwanted by the societies that host them, often fill essential positions that keep societies functioning. But the emerging narrative of essential and frontline worker versus non-essential also served to differentiate between categories of workers and categories of migrant. So on the one hand, if a migrant worker was in an essential sector, so for example, health and social care workers, their presence was therefore permitted. But migrants in roles deemed non-essential became more viable targets for the discourse that their presence was a threat to public health, such as, for example, in hospitality, which was largely shut down during the pandemic. Now, prior to the outbreak of COVID, low-wage migrant workers, and particularly those on temporary contracts or those who were undocumented, they were already disadvantaged on the basis of their positioning within labour markets, which, as I mentioned, segregated by gender, race, ethnicity, and other axes of differentiation. But during the COVID-19 crisis, as male and female migrant workers were both rejected as threats and welcomed as essential, a contradictory attitude became more prevalent. And this was particularly the case for care, food and transport sector workers. And this reflects a prevalent trend of migration being regulated in a securitised, utilitarian manner globally as a just-in-time workforce where migrants' mobility is restricted in a number of gendered ways. So prior to the pandemic, mobility regimes, shaped by state policies and by global regulatory systems, they encouraged some form of migration, noticeably constraining others. But the pandemic exacerbated flaws in the regulatory system, and we argue that this essentially revolves around care in two main regards. So firstly, in relation to the care economy and the care provided by migrant workers, but secondly, in the uncaring system that underpins migrant workers' heavily restricted mobility along this kind of temporariness-precarity nexus. The kind of crisis that was unleashed by COVID-19, it differed from previous crises in many ways. So as Van Barneveld and colleagues note, crises are usually associated with unemployed labour and excess productive capacity, making it relatively easy to restart economies by boosting demand. But in the case of a health-related crisis, industries cannot easily be restarted until the medical crisis is over. Now, in relation to the gendered impact, compared to the 2008 global financial crash, which was described as a man session due to the high levels of job loss experienced by men, the COVID-19 crisis started to be referred to as a she session because women were said to have been more negatively impacted in a range of ways. So firstly, in many countries, the sectors that were initially heavily impacted by restrictions were those that had disproportionate numbers of women workers, such as hospitality, tourism, retail and personal care services. So these sectors experienced high levels of job losses in the early waves of the pandemic. Now, while in previous crises, unless on a strictly temporary contract or a project-tied contract, workers in affected sectors could try and move to another sector to find employment. But of course, COVID-19 made this more difficult. And the restricted worker mobility in the labour market was, of course, due to job losses and business closures in a range of sectors, coupled with the fact that movement restrictions and border closures were in place that prevented workers from being physically able to move. And the second way that the crisis disproportionately impacted women was that unpaid care work increased substantially. So the majority of the care burden was shouldered by women and girls. And in particular, with the closure of childcare, educational facilities and formal care service during periods of lockdown, many women left the workplace in order to care for children and for dependent relatives. And the ILO and UN Women found that over 2 million mothers left the workforce in 2020, which they said exposed the motherhood penalty faced by millions of women around the world in the midst of the pandemic. But the COVID-19 crisis is much more than a global health crisis and more than an employment crisis. but it was a socio-economic and protection crisis, and therefore a crisis of inequality. And this was especially the case for migrant workers who, despite only constituting a small proportion of the global workforce, they were disproportionately impacted in a number of ways. And this was not only due to migrants being at higher risk of job loss, but also because in many countries, migrant workers made up a large proportion of those in essential sectors. And their operations continued during the pandemic, and these workers were at greater risk of contracting the virus. And these are also often the sectors that have been historically under-regulated and under-protected. So the strictly temporary employment schemes through which many migrants are hired, importantly often exclude migrants from social protection, which we'll talk about in a bit. But I want to just flag before passing over to Nicola that COVID-19 also sharpened the existing gender division of migrant labour in a sectoral sense. So we saw agriculture and food processing that had to continue, and this involved mainly male workers, while the key sector of care work, especially domestic work, involved mostly women. We saw construction projects halted in some countries with male migrant workforces repatriated, and this had a knock-on effect in terms of non-payment. And we also saw new jobs emerge and expand, for example, food delivery services such as Deliveroo, which in many countries relied on male migrant workers to operate. So I will now hand over to Nicola.
Thank you so much. I keep us engaged with the particular flow of this paper, so dispense right now with any thank yous for having me here. I add this later. It's a bit awkward being now the second speaker. Anyway, as Laura has already alluded to, what existed already before COVID, the just-in-time production process was very much mirrored in the just-in-time labor supply dynamics. And this is evident from the worldwide shift towards more and more the use of temporary admission policies of any migrant worker, literally worldwide. So it has, as a result, become increasingly difficult for migrants to shift, to first of all enter on a more long-term basis, let alone permanent. So we can see this in countries like Canada, US, Australia, which are traditional settlement countries, as starkly as everywhere else, this kind of global shift towards temporary admission to jobs which are otherwise a permanent feature of the economy. So as migrant scholars, we would talk about, permanent temporality, migrants, never really knowing at what point their status, they might be able to turn their status into something more long-term or set. This is an important feature of migrant precarity, their temporary migration status. Now, when COVID hit and when once COVID was declared a global pandemic, leading to countries shutting down economic activity, of course, this idea of an essential workforce, appeared. And of course, the essential workforce included local national workers who themselves became more precarious as a result of the pandemic. But among this now declared essential workforce were, of course, high numbers of migrant workers, and their own precarity, again, also related to their temporary status. And their temporary status in terms of their migration, and both migration and employment status, but also in terms of the kind of tasks they were performing, most of whom, particularly low-wage migrants in seasonal and project-type types of work. So what happened under COVID then was this interesting dynamic between, on one level, the discourse around essentiality, and on the other level, then of course also the need to sanitize space. So here the idea of sanitizing space having become a key political and policy concern, and mobility was of course increasingly seen as risky and threatening, and in particular the mobility of a migratory population viewed with very, very great suspicion. Yet migrants were facing these interesting dynamics. Of one hand, mobile, part of the essential workforce, and yet at the same time being shut down in terms of immobility. with, border closures, repatriation policy suddenly no longer in place, but also this idea of sanitizing space in relation to things such as because they were mostly temporary migrant workers tied to certain sectors such as agriculture, construction and domestic care. Suddenly also the facing of being tied to certain living conditions in terms of overcrowded accommodation, either in camps or in geographically removed from larger towns and cities in agricultural areas, geographically isolated in terms of also services not reaching them. So here these really important dynamics between on one hand essential, yet on the other hand excluded from important social protection policies and access to particular social protection facilities. In relation to domestic work, also to do with the domestic violence centers, which were of course also shut down and no longer available for migrants. So migrants often employed in essential services, also of course in many ways is not purely by chance, but also because countries of destinations were unable to fill key employment positions with local and local workforce. So the precarity of temporary migrant workers then really accentuated during this period, also as the result of the very limited social protection services and coverage extended to them. And interesting enough, this space was largely filled by civil society and diaspora groups, but more from the point of view of humanitarian emergency. So not really with, in view of a long-term policy change, to really include migrants or maybe tackle this problematic aspects around temporality. So migrants very much found themselves isolated from vital support services. And there were studies conducted around the world, so we see this really all over the world, evidence of this migrant workforce having been excluded from essential social protection services during this particular crisis, the COVID crisis. Shifting slides. So the health crisis unleashed by COVID really accentuated the responsibility for care provisions provided to migrant workers, which in many countries, as these studies were showing, were completely insufficient. So migrants themselves were on one level then seen as essential workers providing care, and yet were left out in terms of their needs as care recipients. So these dynamics completely out of balance. So the irony here really that in many countries, what the one thing that was actually done really well was extending the vaccination programs to migrants, so reaching out to migrants. But this is really where it ended. So migrant scholars, really interested in the human rights aspects around migration were quite excited, thinking, okay, finally this idea of a global right to health is settling into people's mind, but it actually never went any further than including migrants immediately into vaccination programs, and after that it sort of fizzled out again. So we kind of, again, this whole discussion didn't really go any further than these immediate emergency measurements. So which really, unfortunately left us sort of stuck with this idea of expanding the universality around the right to health and right to social protection. Which also really links us back to the original idea of our big project around the global governance of migration, also in terms of the institutional crisis we could see, because very much we have, as much on the global level as well as on the national level, of course, this sort of certain policies being taken care of in pillars, often unconnected. So we have migration policy, employment, labor policy, health policy, and we see this on the global level as well. How these areas continue to be pretty much run parallel, disconnected, out of sync, and only during a very, very short moment of time, the key international organization move back onto the into this space of creating, dealing with this crisis, the International Labour Organization, which is really the most important international organization, which actually covers all these three areas, employment, labour, social protection, and migration. And again, migration scholars were on one level, despite obviously COVID and pandemic having been a massive crisis, getting really excited, thinking, oh yeah, finally, people realize we need to combine, we need to really bring these three areas closely together. But again, unfortunately, it didn't last very long. Once we had the vaccine in place, as far as the global governance of migration is concerned, the ILO yet again was shifted into the background. Another international organization marched back in, the IOM, whose interest is really more in border control and actually regulating the mobility of migrants under a more restrictive heading, and not really interested in human rights aspects. So from that point of view, the institutional crisis around how we regulate and govern migration and the mobility of workers as well as refugees has unfortunately, by this crisis, not really been moved forward, despite this short moment where everybody got excited and thought, yes, finally, the world realizes we need to bring these different areas and aspects of migration, employment, and health together. So what this really left us with. So what we were trying to do in this particular paper was really, we were trying to shed light on how different crisis moments and their gender effects are played out in migrants' lives, particularly in relation to institutional responses and also the lack of these responses. So the COVID crisis simultaneously really exposed pre-existing cracks in the global migration system, whilst also creating new challenges around the provision of essential services in a range of sectors that keep societies functioning. And in turn, migrants were, again, largely left, stuck in these highly precarious situations and subject to these intersectional excesses of discrimination and inequality. So the temporariness-precarity and essentiality nexus then is really a story of the contradictions, as migrant workers are on one hand mobile, across borders, part of an essential workforce, yet remain immobile within inherently gendered labor markets to the level of forced labor in some cases. And this situation really, or in many ways, the migrant workers, those in and out of work during these pandemics, found themselves placed outside of the scope of social protection schemes and were less likely to be able to access care, and therefore subject to a largely uncaring nature of the global labor migration system. And in many ways, what we find is in a disrupted, malfunctioning institutional landscape of care, which has, on one hand, left migrants to bear the brunt of these crisis moments, and these dynamics and effects are in many ways highly gendered, both in the sense that it's largely women who carry out paid and unpaid care work, but are also largely underserviced as targets for care, so as care recipients. And it is clear, really, in order to push these debates further, there is a need for much more conceptual thinking as well as empirical research around the idea of crisis and gendered mobility, and the need for much more research that produces robust empirical data on these intersections. We largely drew on reports and data produced during this period, of course, by NGOs and international organizations, as we were, of course, also immobile and couldn't really go anywhere ourselves. So here, for us as researchers, it would be also important to explore these intersections through more robust empirical research, and very importantly also much more research we need to be doing also here on institutional architecture and processes, which we were trying to tease out here a bit more, which is something particularly migration scholars are still in need to engage with much more. So not just the movement of people in particular places, but also really looking at institutions and the processes around the various areas of regulation that affect migrant workers' mobility and immobility. So not just literally the migration policies, but also health, employment, labor, where we still see a lot of disconnect and mismatch. Thank you very much. Yes.
It's based on a handbook chapter that we wrote, that I went and found. We called the title of it. That's coming out later this year. It's about, it's in a handbook on gender and mobilities. So that's it.
Excellent. And the references, if anyone is interested, obviously we can send and share. So this is why we listed them at the end here.
The PowerPoint goes up onto our YouTube channel, so that's why I put there's a full list of references at the end, should you be interested. Thank you very much.